Hello everybody, I'm Larry and welcome to this presentation. This presentation was developed and supported by Adi, Alison, Priyan and myself, and I'll be your narrating host for the duration of this presentation. In this presentation, we're going to be focusing on Verruca Pedis. Firstly, before we dive all the way into it, what is Verruca Pedis? Verruca Pedis infections are benign epidermal eruptions resulting from viral infections of the skin. They are commonly known as plantar warts and are highly prevalent within the primary healthcare setting. The agent responsible for causing Verruca Pedis infections is the human papillomavirus, or HPV for short, which contains more than 150 serotypes. Verruca Pedis infections can come in a variety of forms, which are all caused by different strains of HPV, including common warts, HPV 2, 4, 7, 26 to 29 and 57, Myrmecia warts, which are HPV1, mosaic warts, which are HPV2, endophytic warts, which are HPV4, and more. Viral entry occurs when trauma or damage to the skin occurs, acting as a portal for the virus to enter and invade the stratum spinosum in the epidermis. Infection is caused by the multiplication of small DNA viruses within the nuclei of differentiated keratinocytes, inducing squamous epithelial tumors of the skin and mucosa. The virus can exist on fomites, showers, and swimming pools, which are all deemed high-risk areas for the contraction of the infection. Common audiences for the condition ranges from children to adolescents, as well as those who are immunocompromised. Verruca Pedis infections can have a substantial impact on patients' lifestyles and can be located on the legs, toenails, as well as the dorsal and plantar aspect of the feet and toes. Let's look at the signs and symptoms for Verruca Pedis. Signs and symptoms may differ between patients and reflect on the person's level of immunity and overall level of health. The viral infection can appear as a smooth, round papule with a central umbilication, ranging from 3 to 5 millimeters in diameter. Verruca Pedis infections can appear asymptomatic for some, whereas others can induce pain. The pain is generally caused by pressure on the wart while walking or running, and usually whilst experiencing a history of throbbing pain. Symptoms may differ for immunocompromised populations, including those with diseases such as diabetes and human immunodeficiency viruses, or HIV. This is due to the decreased activation of the immune system to fight the viral infection, resulting in a longer prognosis. But how is Verruca Pedis diagnosed? The condition can be diagnosed by multiple health professionals, including podiatrists and general practitioners. Debridement of the overlying hyperkeratosis is usually the first to be removed, as it is caused by the increase in cell proliferation in the epidermal layer of the skin. However, Verruca Pedis infections can sometimes be hard to diagnose due to having similar symptoms to other dermatological conditions, such as hyperkeratotic lesions, and helimatical, which is corns. With reference to McKenna, 1938, little to no pain indicates callosity, whereas plantar warts are more prominent when pain is consistent for the patient. Verruca Pedis and helimata can be distinguished by how the pain is perceived upon impact to the site of trauma. Pain stimulation between lateral and medial compression of the lesion indicates the site of the viral infection, whereas direct pressure onto the lesion is directed towards helimata conditions. Upon observation, Verruca Pedis infections appear to have thick hyperkeratotic lesions with capillary thrombosis that can be seen at the site of the infection. This indicates that the virus has harbored the specific area on the skin. Let's look at the clinical course for Verruca Pedis. Verruca Pedis most commonly affects young children and adolescents, possibly due to the exposure to warm, moist environments around swimming pools and changing rooms when learning how to swim. Non-immunocompromised patients usually see a clearance of Verruca Pedis within 12 to 24 months with or without treatment. These patients will often seek treatment through a general practitioner due to feeling a sense of discomfort when they are walking, or to remove them due to feelings of embarrassment or self-consciousness. Immunocompromised patients may experience the verruca for a long period of time or may not see a resolution at all due to the HPV-induced immune response, which does not have any effect on the virus itself. When we're looking at the key evidence-based treatments for Verruca Pedis, given that 2/3 of Verruca Pedis resolve spontaneously, patients may choose to just wait and see, which will require patients to alter everyday behaviors to inhibit the spread of infection, or over a period of months or years. However, this method requires committing to a long period of altering everyday behaviors, which might be an inconvenience for the patients. With watchful waiting, there is also a higher chance of recurrence and higher rate of resistance to future therapy. If some symptoms persist or patients choose to consider wart removal, further treatment is recommended. Within the healthcare setting, varying evidence-based treatment plans are available for Verruca Pedis infections from different health professionals. Solutions to eradicate the virus include mechanical, chemical, and immunological options, whereby specialists' attention may be required. All these methods ultimately aim to disrupt the wart and kill keratinocytes infected with HPV. Chemical options for treating Verruca Pedis include topical application of acidic compounds on the wart. The acid within the compounds dissolve excess keratin and kill the infected keratinocytes by inducing local inflammation. The most commonly used acidic agent is salicylic acid. Salicylic acid is the first-line treatment for Verruca Pedis, as it is commonly available and easy to use. It is available at pharmacies in solutions, gels, and medicated discs, whereby pharmacists can provide additional information on doses if the patient wishes to treat themselves. However, for the majority of the cases, salicylic acid therapy under the supervision of a health professional is strongly recommended. Additionally, treatment with this acid is virtually painless. This makes it a lucrative option for treating children and a superior option for adults, since other treatments like cryotherapy can be quite painful. Treatment with salicylic acid requires daily application, with treatment ranging anywhere from a week up to 3 months. Looking at some further evidence to support this, the second common method of treatment is cryotherapy. This involves the use of a freezing agent such as liquid nitrogen to freeze the plantar wart. This can be applied with a cotton swab or cryogun, which is a spray, to initiate contact with the viral tissue. Liquid nitrogen, which has a boiling point of -195.8 degrees Celsius, will freeze the affected skin. This causes a localized burn and induces the death of infected keratinocytes. Cryotherapy is generally viewed as a second line of treatment, mostly due to its limited availability, as it cannot be purchased over the counter. Patients need to visit their health professional regularly for treatment. Additionally, cryotherapy tends to cause pain and induce an inflammatory reaction, so it causes blistering, making it a less lucrative option. A course of cryotherapy involves freezing the wart using liquid nitrogen at regular intervals. The inflammatory response induced by freezing leads to gradual regression of the wart. If treatment with salicylic acid and cryotherapy fails, the wart is classified as a treatment-resistant wart. This will require referral to specialists, such as a dermatologist, for other treatment options, such as immunotherapy or surgical removal. Immunotherapeutic agents like DNCB or imiquimod can be used to treat the wart. However, evidence regarding its efficacy is very limited. Surgical options like curettage and electrosurgery can be used under local anesthetic to remove the affected cells. Other alternative treatments include thuja ointments and natural home remedies may assist in resolving the viral infection. For those who would like to research further, these are the references to support you on your quest to further understanding Verruca Pedis. Thank you so much for joining me on this presentation, and I hope that you have learnt a lot about Verruca Pedis to take home from this. So on behalf of my team and myself, we would like to thank you for your attention and wish you all the best on your further study endeavours.